Oh, a very good afternoon, ladies and gentlemen. Thank you very much for attending today's symposium. Thank you very much for registering and taking some time to attend today's symposium so that we can learn together on this very important aspect which is present in our today's discussion. So today we are so lucky to have our guest speaker, who is pharmacist Nabila Ahmed. Nabila is a pharmacist. She's a pharmacist, studied pharmacy at the Muhimbili University of Health and Allied Sciences before going forward for the Masters in Public Health from the KCMC University. And now she's working with the USAID Global Health Supply Chain in Tanzania, where she mainly works on the demand planning management for HIV, TB, malaria, essential health products, and the COVID-19 commodities. So she has more than 10 years of experience in this business, and we believe that she is much seasoned and very much capable and in place to share with us what she has been doing in the previous 10 years, especially in this topic, whereby she will be highlighting on the performance and the concerns of health commodity supply chain management during this era of COVID-19. So with that, I would like to welcome you, Nabila. For those who do not know me, my name is Nelson Masota, and I am moderating today's session here in the Farmers Forum East Africa. We have many more participants who have registered from different countries around the world, and we believe they will be joining us in the course of the presentation. For the interest of time, we would like to proceed. So Nabila, you are welcome.
Thank you for the introduction. As mentioned, today I'll be presenting on the practices, performance, and concerns of health commodities supply chain management in the COVID-19 era, and this will be specific for the Tanzanian perspective. During this presentation, I will be presenting as myself without affiliation to my current organization. So this presentation is going to cover the following areas. One is an introduction. The second is the supply chain overview, the causes of the disruption that were observed during the COVID-19 pandemic, the implications of those disruptions, and recommended way forward. Just to start off, what exactly do we mean by supply chains? Supply chains are described as networks of firms collaborating and coordinating to achieve a common objective of ensuring product availability. Understanding the meaning of supply chains is important because this is one of the reasons or one of the core areas why this area was highly affected during the COVID-19 pandemic. Additionally, on the supply chain overview, as I mentioned before, supply chain is a network of firms. So we have different groups of people stationed at different levels or tiers of the supply chain, and they're all expected to work together in order to ensure the final product is available to the last consumer. So the current visual summarizes what the supply chain overview entails. Ideally, you have a certain group of people that would work on raw materials. And this would apply to any supply chain, by the way, whether it is related to health commodities or non-health commodity areas as well. So you'd have a group of people that would be working on raw materials. You'd have a second group of people known as suppliers that would be collecting those raw materials and moving them to the next stage. You then have the manufacturers that are going to take those raw materials and then convert them into a finished product that can be used. You have another group of distributors that collect those products and distribute them to final customers. The next group is the customers that receive the items, and the consumer, who is the last person or the last people to use the products that have been moving through this supply chain. So it's important to grasp this overview of the supply chain, including the different firms and the different groups that are supposed to be collaborating and coordinating as a network in order to ensure achievement of the final shared objective or the shared goal. Now, apart from looking at supply chain in terms of the different firms, as I mentioned before, in the network that is involved, some of the key elements that are involved in any supply chain include people, process, and technology or IT capabilities. So on the first part for process, this includes all the steps that firm would be taken into account in order to ensure successful achievement of the final business goals that are part of that firm. And part of this includes engagement and tying the processes to the corporate mission, vision, and strategy. So what are the strategies or visions or missions that are driving that particular firm? The second part in terms of process is implementing and prioritizing the methods of the project as well as the roadmaps that have been agreed on to achieving the goals or the visions of the firm. The third part in terms of process is standardizing and documenting business processes. And in this area, what firms try to do is align with the current global standards. Again, I mentioned global standards because in the context of COVID-19 pandemic and the disruptions that occurred, standardization and documentation of processes across different firms became even more important. I will explain more in the next slides. The next part is in technology and IT capabilities. As we all know, in order to ensure a smooth implementation of a supply chain function, you need to have up-to-date technological solutions that are able to collect data, analyze it, and inform you on how you should proceed with product planning as well as product distribution, and in the last parts in product consumption. At the same time, you need to ensure that your current tools for collecting data through technology are in line with existing collaborative approaches so that whatever data you have, it can easily be shared with other firms along that supply chain network. And in the last part, which is the most important, is in people and user needs. Here you need to ensure that everything that you're doing in your supply chain and the products that you're trying to deliver to the final user align with the requirements or with the expected demand for that last user. At the same time, you need to ensure that adequate trainings and programs are there in order to encourage data-driven decisions at the user level. Because as I will share in the next slide, the data that's generated at the user level helps inform other firms along the network of the supply chain. Now, this slide shows an example of generally two types of supply chains. The number of days depicted here is used an example, but if we can grasp these two types of supply chains, it can help us understand some of the disruptions or the implications of those disruptions that were faced during the COVID-19 pandemic. So in the first part, we have the traditional supply chain. In the event that you have a demand spike means you suddenly have an increased requirement or an increased need for a certain product, maybe by 250%. In the event that you have that demand spike, it would first be detected by the retailers or the final stores. In the previous slide, these were the customers. That information is then expected to be shared with the retailer's warehouse. So you want that store to inform their immediate retailer that my demand has now increased. I will need you to supply me with additional stocks going forward. And that retailer is then also going to share that information with the respective manufacturer, that in my area, I've collected information from all my stores, and they've all reported that there's an increase in demand. So I'm also going to ask for additional stocks from you, the manufacturer, going forward. That warehouse at the manufacturer level is going to share that same information with the manufacturer's factory, and they will also share the same information with the raw material. Now, in the traditional supply chain, as you can see from these arrows, this blue arrow is information flow, and then the green arrow at the bottom is a product flow. So the idea is that the retailer store would share information with the retailer's warehouse in around 1 to 2 days. And then that retailer is going to respond back to the store in 1 to 2 days. And then respectively, the retailer's warehouse is going to share that information with the warehouse in roughly 2 days. And then that product will be shared back in around 2 to 3 days. The same is propagated along the supply chain. Between the manufacturer and the raw materials, it could be maybe around 4 to 8 days. They would share the information. And then additional raw materials would be provided to the manufacturer in certain days as well. So when you sum up all these number of days, in this example, it comes to around 10 to 18 days. This is the traditional supply chain. Going forward, the idea is to have demand-driven supply chain. So instead of having these small blue lines, information being shared between 2 different tiers or 2 different nodes of the supply chain, you want to have real-time information that's been consistently shared from one end of the supply chain to the other end, the end-to-end data visibility that we talk about every day. That means regardless of whether or not you need stocks from the immediate upper node of the supply chain, your data should be readily available. That is real-time information sharing at all times. And that's why you can see these blue lines. You have the store sharing data at all times. You have the warehouse sharing data at all times. You have the manufacturer sharing data at all times, and the raw material sharing data at all times. So data is consistently being available at all times. And then the only thing that is left is to work on the demands or the orders that are coming in so that you can meet the requirements that are coming in. Now, from these 2 types of supply chains that are presented here, the idea is that with the modern demand-driven supply chain, you're able to respond much faster to demand spikes. As you can see, the number of days has reduced. You no longer include additional days required for information to be shared. Right now, the number of days is only driven by movement of the product from one node of the supply chain to the next. So the idea of the demand-driven supply chain is that you reduce the number of days that's needed in order to respond to sudden demand spikes. Now, sharing these 2 types of supply chains, I hope you can see how this had an impact during the COVID-19 pandemic, as I'm going to share in the next slide as well. Some of the causes of the disruption that were observed during the COVID-19 era, one was data quality due to constrained reporting capabilities. The other was lockdown, production halls. Some manufacturing companies or industries were closed during the pandemic. Therefore, some products were not available at all. There were restrictions of movements of people and goods, border closure, but as well as logistical constraints. Vehicles, whether they were on land, by sea, or by plane, were not adequately available in order to move products from from one node of the supply chain to the next. And all these disruptions in one way or another, or the majority of them, can be linked with the lockdowns that occurred, as well as the restrictions for people to be close to each other in order to avoid further spread of the COVID-19 virus, in order to avoid further infection. So that policy that we should have social distancing in order to reduce the spread of the infection had an effect on all these other components that were required in the supply chain. Now, I will just go back again to the previous slide so that we can see how these disruptions affected the supply chain. As I mentioned before, despite the maturity of your supply chain, whether you are working in the private sector, public sector, whether you work in health commodities or non-health commodity areas, during the COVID-19 pandemic with restricted movements, it meant that one, the data that was expected to be shared continuously, there were disruptions in terms of that data, including the accuracy of that information. Just to add on to this, long-term, the effect that we've also come to see for data is the bullwhip effect. And this has been seen across different supply chain groups, including the Western countries. So the challenge that right now people are having is that the data that we've seen before is demand spikes for some of the commodities, and in some commodities, you have absence of data reporting either spikes or low consumption. So the challenge that has come is that post-COVID, what kind of data are we going to work with? Do we reflect the changes that have happened during the COVID and take that into account? Or do we move on with data that was available before the COVID era? So that's one of the challenge and discussions that's been addressed in several forecast and demand planning forums right now. There are different experts especially in demand planning, that are coming up with ideas about how to calculate your future requirements in order to avoid this bullwhip effect. For some of those supply chains that had matured a lot more along the line, they were able to face less disruptions, especially if they already had real-time data that was available end to end. Again, as I mentioned before, with COVID-19, even for supply chains that had matured, even if they had real-time information, they still face disruptions in terms of movement of commodities because of restricted logistics, as well as restricted movement of people and goods. So both levels or both types of supply chains still felt the effect of the COVID-19 pandemic. And just to add on as well, so that we can further understand the next slide about the causes of the disruption. With supply chain, you have different firms or different groups of people that are supposed to work collaboratively, and they're supposed to coordinate as a network. Even without the COVID-19 pandemic, that on its own is a challenge. It's a challenge in terms of different ways. One is transparency. One is perspective of competition and how much information you should be sharing with other firms along the network. The other one is shared goals. So it's not really straightforward as this visual looks like, that it's in the interest of this manufacturer, or it's in the interest of this retailer to make sure that with the given lead time, they will collect whatever products that they have and then distribute them to their previously identified customers or users. A lot of competition happens. There's a lot of geographical setups in terms of where retailers and where manufacturers prioritize to distribute their goods. All these challenges were already there even before the COVID-19 pandemic. What we came to see during the COVID-19 era was an amplification of challenges that were already there before, including having shared goals, transparency of data, and so forth. So I just wanted to go back to that so that we have an idea of challenges before the pandemic, challenges during the pandemic, and how they were viewed by different firms in the supply chain network. Now, the implication of the disruptions that I've just mentioned is that a lot of firms have been reconsidering or restructuring or revising their existing strategies for supply chain. So that means overall how they're working in the past, they are trying to revise that. And that includes their current data setup, their tools, the current collaborative mechanisms for how they can engage with other firms, and even internally, how they can engage with different departments within the same firms. Because what everyone learned during the COVID-19 pandemic is that with the lockdown and restricted movements, you need to find innovative ways to share information and to work together with other colleagues within your firm and with other firms. At the same time, this had an implication also on outsourcing strategies. So outsourcing strategies is closely related with procurement mechanisms. As you all know, most of the raw materials that are used across the globe, majority of them come from China, followed by India, including for health commodities as well. So one of the challenges that was noted during the COVID-19 pandemic is that with restricted manufacturing in different countries, as well as limited availability of raw materials and active ingredients, different firms and organizations needed to rethink how they can source their products. Being highly dependent on certain countries or being highly dependent on certain suppliers has shown to be a very risky approach. In addition to that, apart from revising strategies, this also had an implication on strengthening existing supply chain systems. So what the COVID-19 era has shown or has implied is that we need to invest more on improving our current systems, whether they are modalities of collecting data, reporting them, having real-time analysis, not just real-time data collection, but also real-time analysis. What we've learned from the pandemic is that you don't have the luxury of using time to analyze and collect data if that can be done seamlessly. So these are some of the approaches that firms and organizations are trying to look at to employ long-term. In addition to that, another implication of the disruption was inadequate data quality to inform decision-making. This goes hand in hand with the first and third implication that I mentioned around supply chain strategy, as well as implications for increasing investments to strengthen current supply chain systems. I believe this is my last slide, and it aligns with the challenges that I have just mentioned. Some of the lessons learned after the COVID-19 pandemic, or after the main waves of the COVID-19 pandemic, is that we need to improve transparency between different supply chain firms. We need to improve electronic systems for capturing data, as well as having real-time data, and going forward, potentially having real-time analytics as well. We also need to employ strategic procurement approaches and reduce risky mechanisms that highly depend on few suppliers, as learned during the pandemic. At the same time, we also need to improve our current analytical methods as well as tools for capturing real-time analytics. Several firms have been looking at the potential for employing artificial intelligence as well as machine learning in order to capture these real-time requirements or needs going forward. But what has also been learned is we need to revise the approaches to address the risk of the bullwhip effect. There are several other forums in the past months, specifically for demand planners, whereby different experts have been sharing their approaches to address the bullwhip effect. As I mentioned before, the challenge that was observed previously is that you have data that was being collected from your consumers and users before the pandemic, and then you have data that was coming in during the pandemic. Now that we're going post-pandemic, what kind of data can you use to plan for your commodities going forward? And this on its own is not straightforward as it looks. With the pandemics, depending on the different commodity groups, there's been a lot of reshaping in terms of working culture, in terms of prioritization of commodities that are needed. And that reshaping has implications. It's not as easy as it seems to go back to the previous product segmentations that were available. So a lot of analysis needs to be done right now, as well as revisions for current requirements. And all of this needs to be people-oriented. We need to look back to the users and the final consumers and see how have they changed post-pandemic, and how can the supply chain align to the changes that have been observed. Specifically for the area that I work in, which is in public health commodities in Tanzania, the same challenges have been observed as well. But going forward, a lot of lessons have been learned, and the working cultures across different firms has also changed. For example, this current Zoom webinar that we now have, these tools were not frequently used before the pandemic. But I recalled during the pandemic, a lot of people learned how to use Zoom, how to register for different webinars, how to schedule Zoom meetings. So the same implications have also been reflected in the public health supply chain system in Tanzania, including how to adopt more modern collaborative means of working together. Thank you, everyone. That is all for my presentation.
Very much, Nabila, for a very nice and enlightening presentation. I believe the majority of us have benefited a lot from this talk. It was concise, and I believe it was so informative to everyone. And now, dear participants, the presentation is open for questions and discussions. If you would like to contribute, please welcome, and you can do so in two ways. One is you can raise your hand using the raise hand function here on Zoom, and I will call you to ask your question directly here or give your contribution. And second, you can use our chat function and write your question directly in the chat box, and we will read it for you. With that, I already see the hand of David Miemba, and David, you are welcome to ask a question.
Thank you so much, Masot, for this opportunity. I don't know if I can be heard well.
Yes, we can hear you.
There's some background noise anyway. Okay, so it was a very good and nice presentation from pharmacist Nabila, and I really like what she presented. So I have a couple of questions actually, but I'll pose one first, and then I'll see how the reaction, and then I will see if I can ask more questions. I want to know actually whether during the COVID-19 pandemic, the impact of the disruption of the COVID-19 pandemic on supply chain was more pronounced on certain product types than others. For example, maybe vaccines were affected more than other product types, and what were the effects, the downstream effects of that? Yeah, so that's my question for now.
Nabila, you're welcome. You can proceed with answering.
Thank you, David, for your good question. As I mentioned, the challenges that were faced, one of the main challenges that was faced in the COVID-19 pandemic was restricted movement of people, goods, and people, and the vehicles as well, as I mentioned, with the restrained logistics. Specifically for vaccines, this is not an area that that I work on. It's not my area of expertise, but my understanding from the modality that was used in our country, in Tanzania, is that because we didn't have we didn't face the full impact of lockdowns and restricted movements based on the country's policies during that time. We didn't face that much of a challenge in terms of movement of products in our country. However, what was some of the mechanisms that were taken for upstream, because that's where the major challenge had come during the COVID-19 pandemic, the movement of commodities from other countries to Tanzania. In terms of upstream logistics, that is where the challenge had come. But even then, in my view, the Ministry of Health, in collaboration with partners, including WHO and other partners as well, had worked very much to minimize these effects, as well as to maintain a resilient supply chain. There are different mechanisms that were used. In some cases, it was advanced ordering of products from other countries. In some cases, it was additional support from partners to transport those commodities to Tanzania. In some cases, it was increased volumes ordered from other countries to Tanzania. Now, all of these are not routine approaches that were used before the pandemic, but there are mechanisms that were employed during the COVID-19, and this was as a result of a close partnership between different stakeholders in the country. Thank you.
Thank you very much. Thank you. David, do you still have another question before we proceed?
Yeah. So, yeah, thank you. It was a very good response. So I have a couple more questions. So we are still in the middle of the pandemic, actually. Maybe we can say, other parts of the world, Europe, America, and they are still feeling the effects of the pandemic. And we cannot really say that the pandemic is over. So, so I would like to know whether whether the implications and the impact is still felt even now. And how do you see the future as we move on? So that's one. But second, you talked about data quality and the absence of data, and about strategic interventions in the supply chain. I would like to know whether you think, this is not very practical, whether you think if having a computer model, something that we can use to forecast demand and kind of guide strategic policies and interventions, and to see the impact of different interventions can help before actually going to implement in the real world. Yeah, so that's all for me.
Thank you. Nabila, you're welcome once again.
Thank you, David, for your good question. You are right that the effect of the COVID-19 pandemic is still being felt right now. But from my experience working with public health commodities, you cannot compare the effect that we're seeing right now compared to when the pandemic had started. During that time, there was a lot of questions that were being asked around transportation of commodities to come to Tanzania in terms of vehicles that were available, whether it was aeroplanes or shipping lines. So there are a lot of challenges back then, although they're still being felt right now, but the impact, in my view, has decreased compared to before. At the same time, as a demand planning specialist, what I have noted from different health commodity planners in the public as well as the private sector is that everyone has been adjusting to the current challenges or disruptions that were brought about from COVID-19. However, the impact or those disruptions have reduced compared to how they were at the beginning. And in terms of what this means for us in the future is that looking at other international forums that have also been discussing the effect of COVID-19 pandemic on supply chain, one is that stakeholders, in my view, have come to appreciate the importance of having a resilient supply chain. So right now, folks are no longer talking about having a good supply chain. Right now, everyone wants a resilient supply chain. And by resilience, what we mean is that in the event that a disruption occurs, your existing processes or performance does not shake to a point that it affects you to achieve your previously set goal, which is what had happened during the COVID-19. A lot of people came to learn the importance of having resilient systems. As I mentioned from my presentation, you can see some hints and clues that would lead towards the resilience that I spoke about. One included strategic sourcing mechanisms. You wouldn't want to rely on a few suppliers, and then if those suppliers cannot meet your demand, your supply chain falls. If that happened, it means that your supply chain is not resilient. It's not ready to respond to different risks or different disruptions or different problems that may occur along the way. In terms of data quality, I think I can comment for public health commodities in the country. In my view, when I look at the current public health system, let's forget about supply chain for a moment. In my view, when I look at the public health system that we have in Tanzania, it's quite a strong one, and the Ministry of Health has been doing an amazing job to oversee that it's been managed in a proper way. The number of public health facilities in Tanzania is nearly 7,000 and growing, or more than that. In order to address commodity requirements across all these facilities, the ministry already has electronic systems to capture data from all these facilities. We have the commonly known DHIS2 system, which is used across multiple countries and multiple setups. The same system is also being used in Tanzania. But at the same time, the government also has another system for logistic management information system for collecting health commodity data specifically. And this is one of the main sources that inform supply chain supply chain management in the country. So we already have computer models and electronic systems for capturing data. Something that has been advocated even before the pandemic started is to increase investments for computers and electronic tablets to be available to healthcare workers across the 7,000 facilities that I mentioned. They are there in some health facilities, but not in some. So increasing investments to make sure that everyone has tools in order to enter data electronically. That's an area that I think we can still work on. But in terms of the existing health systems in the country for capturing information, I would say that Tanzania is quite matured compared to other African countries. And going forward, the Ministry of Health has also been advocating for, has been implementing decentralized planning for commodities. That means facilities take the responsibility for not only reporting commodities that they're using, but also planning going forward for the commodities that they're going to be needing. So that level of decentralization and investments that have already been made for our current information systems, I think is good, but additional could be made to ensure availability of tools to capture these data. Thank you.
All right. Thank you very much, Nabila, for the nice response. Maybe to add on that on resilience, I would like to ask, in the model which you shared, the new model of the demand-driven model, apart from the traditional supply chain, you clearly indicated that from the retailer to the manufacturers of raw material, everyone can simply share the information in the open. It's like the real time, you say. But I think for the developing countries like ours, most of the time, a bigger part of the manufacture of raw materials and even finished product are outside our borders. So I would like to know, how easy is it for the manufacturer of raw material or finished pharmaceutical product who is based in China or India or Italy, how easy is it for them to receive this real-time information from the retailers or wholesalers who are in Tanzania? How are the dynamics in this area, please?
Thank you for your good question. And you're quite right that in our current setup,
Hello, Nabila, are you there? Hello, Nabila, can you hear us? Okay, sorry, I think we have lost the connection with Nabila and she will resume shortly.
Hello, everyone. Apologies for the slight. Apologies for the slight disconnection.
Okay, you can proceed.
Thank you again for your good question. You're quite right. In that slide, I was sharing the two examples of supply chain. We have the traditional supply chain model, and then we have the modern supply chain model that we aspire to reach someday. Your specific question was, how easy is it to reach a level whereby we can have end-to-end data visibility all the way from the manufacturer to the final consumer or the final node of the supply chain? So on one hand, I would say, first of all, it depends on the product's category. It also depends on how that engagement or how that mechanism can be built. As I mentioned before, even before the COVID-19 pandemic, one of the challenges that were being faced in managing a network of firms in supply chain, we have transparency, readiness to share data, concerns for competition between different firms and how that information would be shared, as well as the shared goals between the different firms. So in order for us to enable that, that kind of real-time data sharing from the first node to the last node of supply chain that I presented, these are some of the key areas that would need to be addressed. However, before even that, for the public health supply chain system in our country, I would say that we're in the future, I feel that we're going to get close to reaching parts of that modern supply chain. I say that because in the Tanzania public health sector, we have health facilities that receive commodities from zonal MSD warehouses, and they receive commodities from the central MSD warehouses. There are already interventions and investments that the ministry has been putting in place in order to ensure harmonious data availability between MSD warehouses, central MSD, as well as the health facilities and different demand planning offices that are available at the Ministry of Health and TAMISEMI as well. So this leadership willingness that has already been shown and the interventions and investments that are already there between the government as well as partners is a very big step that Tanzania has already achieved, because we already have strong foundations to achieve the modern supply chain that I had, modern supply chain model that I had presented, at least our country itself. This also includes some of the steps or interventions that have been done for interoperability between the different systems that are collecting data. So you have MSD that have their own data collection tools, and then you have facilities with their own data reporting tools. If you can have these systems speaking to each other, that is interoperability, you're getting closer to that modern supply chain whereby you have real-time data and you have less time being used for reporting data, and you can focus more on moving commodities. Thank you.
Okay, thank you very much, Nabila. We have a question in the chat box from Samuel Mabewa, and he is asking, during COVID-19, Tanzania and other countries had to adjust their systems to cope with the current situation. We witnessed many systems shifting to digital system for meetings and other functions. My questions are, one, how did these adjustments affect the supply chain processes in Tanzania, and how was it managed? And two, due to the situation across the globe, we witnessed that most suppliers and manufacturers either shut down in their operations or encountered massive delay of orders. How did Tanzania cope with this and ensure the constant supply of commodities? And I think he has one last question saying, and lastly, not only the government, but also all stakeholders involved, how are they handling the adjustments now, and how are they prepared if we are to face another situation like this? Are there permanent measures in place? So welcome for these three questions together, please.
Thank you, Samuel Mabewa, for the good. How did the adjustments affect the supply chain processes in Tanzania, and how was it managed? So you're quite right. At the very beginning, in terms of models for meeting, collaborating, and coordinating with stakeholders in different parts of the supply chain, it usually involved face-to-face meetings. So As I mentioned before, one of the adjustments that was adopted during the COVID-19 was to approach tools to support remote working, as well as tools to support remote collaboration between different stakeholders. We definitely saw a rise in the use of Zoom meetings and Google Meets and Google Meetings during the COVID-19 pandemic, something that was not normal or routine before the pandemic. So that is how one of the areas how stakeholders had adjusted or had adjusted to the COVID-19 effects. On the second question, which is due to the situation across the globe, manufacturers or suppliers that shut down their operations, leading to delays of orders, and how did Tanzania ensure a constant supply of commodities? So this again varies between the commodities. It depends during the COVID-19, what was the status of that commodity when the COVID-19 pandemic started. For some commodities that were already adequately stocked, different supply chain planners were able to adopt, or they were able to buy in time in order to place orders or in order to restructure their previous mechanisms for procurement as well as deliveries. Some commodities were affected, yes, especially those that that were probably understocked or were not adequately stocked right when the pandemic started. But in terms of adopting to the problem as it was being faced, as I mentioned before, there are different approaches that were used, or different ideas that came up as proposed by partners and other stakeholders. One of which was advanced ordering. The other was increased volumes that were being procured. And the last was close collaboration with partners and other stakeholders in order to build on available resources for transporting commodities. As I mentioned before, there were a lot of constraints in terms of logistics. That close partnership and collaboration with stakeholders meant that if one partner or stakeholder could secure an aeroplane, then through close collaboration, you can build on that resource and use it to transport your commodities to be delivered in Tanzania as well. So there are different approaches that were used in order to address and ensure constant supply of commodities. The ones that I've mentioned are just some of the ones that I had experienced or I had seen based on the work that I do. On the third question, which was not only to government, but to stakeholders involved, how are they handling the adjustments now and how are they prepared if we're to face another situation like this? Are there permanent measures in place? So the main one that I would say that has received more attention now compared to before is building resilient supply chains. I mentioned before how Tanzania is lucky to have matured systems in terms of health, not only for data reporting, but even our supply chain systems is matured compared to other countries. The lesson learned during COVID-19 is that, yes, we have the supply chain system, but now what we need to do is look at what are the potential risks that could be incurred and how can we make our current system be resilient in cases of future disruptions. Therefore, the future right now and some of the permanent measures that I'm seeing coming forward is more investments on resiliency and not just on the current matured supply chain system that we already have in Tanzania.
Okay, many thanks for that response, Nabila. And the next question is from Hadija. Semvua and saying, congratulations, nice presentation. My question is, which type of supply chain is commonly used in Tanzania among the two presented? So maybe you already highlighted on this, but you can just repeat for her. Welcome.
Thank you, Hadija Semvua, for the good question. I would say we are on a hybrid, or we are moving towards the modern supply chain that I mentioned. The good thing that gives me confidence to say this is because there are already a lot of interventions underway, especially for public health intervention, for public health systems, to create an interoperability between the different systems that we have from the suppliers and from health facilities. Achieving those interoperabilities is going to be a big step towards achieving the real-time data availability that was presented for the modern supply chain. So we are headed towards the modern supply chain model that I had presented.
Okay.
Thank you.
Thank you very much. David Mnyemba is asking again, what do you think about having a cross-border supply system in East African region? Please, if you can respond.
Thank you, David Mnyemba. To be honest, this is not an area of expertise for myself in terms of models that have been explored to have cross-border supply chain systems in the EAC region. But perhaps in future forums that we have through this through the Pharmacy Forum for East Africa, this could be a topic that could be further discussed in the future. Thank you.
Okay, thank you. I do not see any other question in the chat box. We still have a lot of time to discuss, but in case we do not have any question or contribution, we can stop where we reach. And I have maybe one other question to ask you, Nabila. Can you comment on the impact of this COVID-19 era, maybe in relation to supply chain management and the quality of the pharmaceutical products at the end to the final user? What impacts or challenges are there on the quality aspect?
Thank you for the good question. As mentioned before, in terms of the impact of COVID-19, the COVID-19 pandemic, it definitely affected the data that was available, as well as some interventions that were being implemented to support public health programs. But in terms of quality of health commodities, during my experience, especially when interacting with other stakeholders specific for public health commodities, I did not see an area whereby there was a compromise for the existing steps to ensure quality checks are in place for commodities that were being delivered in the country, especially for consumption in the public health system. So maybe just to add on to that and what that means. When the COVID-19 pandemic began, there was a need to, of course, adopt to the changes that had happened, including a need to expedite movement of commodities. You wanted your commodities to move faster. So they were moving faster between the supplier coming into the country. And then once received, we wanted those commodities to move faster from the national level of the country going down to health facilities. Despite efforts that were made among supply chain stakeholders to expedite the movement of commodities, I do not recall at any point whereby there was a compromise in terms of the existing QA checks for the public health commodities. This means that Whatever lead times were faced for quality assurance, those were maintained. The lead times that everyone was striving to reduce was the actual movement of the commodity between 2 points of the supply chain. I hope that answers your question. Thank you.
Okay, many thanks. Is there still a question from the audience, please, or a contribution from your experiences? Yes, I see the hand of Gilbert Matesh. Gilbert, you're welcome straight to ask your question or contribution, please.
Thank you very much. And I'll start by commending Nabila for a very wonderful presentation. And so mine is it's not a question per se, but probably could be a way to think of the question that David Mnyemba has asked with regard to the cross-border supply chain system. So at the moment, I don't think if we have sort of like known existing cross-border supply chain system for East African region, but I think underneath different parts of the supply chain, I think there are some work that has been going on across the East African member state countries to ensure that the whole process that affects or goes into the supply chain is sort of like improved. So we're talking of East African registration regulatory authority with regard to medications. We know, for example, in Tanzania, I think it is allowed to import some products that are registered within East African member state countries that might not necessarily be registered in the country, but so the whole process of importing those products is sort of like not as stringent as it would have been, and so that in a way facilitates products movement across the country. I do understand this might not be specified for East African countries, but I know our medical store department a couple of years ago was chosen to be the supplier for medicine, I think, across other countries. And so that by itself, I think, presents as a hub where some of the products might be stored within the region and then facilitate easy distribution of the products when they are required. So in a sense, we cannot say like we have a cross-border supply chain, but I would say that there are some sort of like parts of the supply chain that are working within the region that cross the border and might in one way or the other facilitate movement of the products across member state countries. And I think we might be going towards if I can call it a cross-border supply chain system. So that will be my contribution to the topic. Thank you.
Yeah, thank you very much, Gilbert, for a wonderful contribution to the discussion. Apparently, we have a question from Dr. Betty Maganda, and she is asking if there is any study conducted in Tanzania to assess the impact of COVID-19 on supply chain of essential pharmaceutical commodities. If Nabila or anyone is aware of any useful study, you can please share your experience or knowledge.
Thank you, Dr. Betty Maganda. I have not come a specific study for impact of COVID-19 supply chain essential pharmaceutical commodities in Tanzania, but there have been other studies that have been conducted in sub-Saharan Africa. Perhaps those could be shared after the meeting.
Okay.
Sorry, Masota, if I can chip in. Actually, I know there's a study that was done last year by a master student at MUHAS. So, I mean, the data is not yet published, but I think we have a study that was done. Yeah.
All right. Thank you. So maybe you can liaise with Dr. Betty to share on the particulars of those information. David. Another question from Nakembetwa Marco, and is asking, thanks Nabila, you presented very well as you always do. I would like to know if the effect of COVID-19 in supply chain is still a challenge in our country, and if we can also project for how long will it take, or will it continue to be there? Welcome, Nabila.
Thank you, Nakembetwa. In terms of, I can speak more for the upstream supply chain, which is the movement of commodities from suppliers outside the country to the country. So in terms of upstream, there is a challenge still based on reports that we've been receiving, but it is at no point as pronounced as it was when the COVID-19 began. So despite the current challenges that are being faced, these are the ones that we can address, so we can cover with the existing buffers of stocks that we have at different tiers of the supply chain, which is something different when the COVID-19 pandemic began. So the challenge is still there, but not as pronounced as it was before. In terms of how long these challenges will continue, this depends on two key areas. One is at the global level, how manufacturers, suppliers, stakeholders involved with the production of raw materials, it depends on how they're going to be adapting going forward and what areas or mechanisms or approaches they will take to change the business models. At the same time, for us in countries, it also depends on how we will strengthen our existing supply chain systems and how we will improve our sourcing strategies during procurement. Thank you.
Thank you very much, Nabila. So I see no further question. And okay, there is a comment from Dr. Betty. Doctor is saying the study was conducted only in Dar es Salaam, apparently. And Nabila, don't you think it's high time in collaboration with GSH and MOAS to conduct this study in various regions of Tanzania? What's your take on that, Nabila? Welcome.
Thank you, Dr. Betty Maganda. I think there is a need to conduct further analysis about the impact of COVID-19 in the country, as well as lessons learned going forward. And these published articles would support other stakeholders in the country moving forward. In terms of collaboration between GHSC, TATZ, and MOAS, our project has been working with different stakeholders throughout its life cycle, but this collaboration, of course, would need direct engagement with the leadership at GHSC in order to see potential moving forward. Thank you for the idea.
Okay, thank you very much for that response as well. So in case there is someone who wants to contribute. Okay, does not seem to be the case. So I would like to thank you again, everyone, for taking your time to register and finally participate in today's discussion. Thank you very much for participating, asking questions, and giving your comments to today's symposium. That is very, very appreciated. I would also like to thank our sponsors, the Action Media and the Christian Social Services Commission of Tanzania. And I would like to welcome all of you to collaborate with us in any way which you think it's possible. If you would like to give a talk in one of our future symposium, you are kindly welcome to contact us on that. Or if you like to advertise your campaign or your product or your business in any way, you are much welcome to communicate with us. We also welcome you to follow us on Facebook, Instagram, and Twitter. We have accounts. All of them are named Pharmacy Forum East Africa. And also you can subscribe to our YouTube channel, where we make it a point to post every symposia in there. And you can also go there and watch the recordings of our previous symposia, so that you can get what was shared in case you did not attend in person. So with that, I would like to thank you, Nabila, very much for attending today's presentation as a speaker, for your valuable contribution, and for so much useful insights that you have shared with us. We hope to have you again next time when we invite you, and many greetings to your colleagues. And with that, I would like to end our today's presentation. Nabila, if you have anything to respond before we conclude, I welcome you. Welcome.
Not at all. Thank you so much for having me. I'm also excited about the questions that were asked, as well as being able to engage with other pharmaceutical professionals. And I look forward to engaging with the Pharmacy Forum in the future. Thank you.
Thank you very much. So dear participants, thank you and see you soon in the next month's symposium. Until then, all the best. Goodbye.